Good day. Today I would like to discuss top challenges facing healthcare CIOs with a focus on meaningful use. Meaningful use was initially introduced to the healthcare world in 2009 and marked the beginning of a federal mandate to increase the use of electronic health records across the industry. The program began by incentivizing those organizations who effectively implemented such technology, and gradually the MU program incentives turned into penalties for those providers and organizations who did not get on board with the mandate. Meaningful Use identified several lofty goals, including improving quality, safety, efficiency, and reducing disparities, all while improving the health of populations and ensuring privacy and security of personal health information, or PHI. Meaningful use was divided up into three strategic objectives or stages. By way of overview, the first stage began in 2011 and focused primarily on implementing EHRs that were designed to capture information. The goal of this data capture was to utilize that information to track and trend certain patient populations. The second stage began in 2014 and built on the work of the first stage with a growing focus on health information management, e-prescribing, electronic transmission of patient care records, and more. Finally, the third stage began in 2016 with a focus on standard decision-making support for providers who found themselves treating populations with identified high-priority health conditions. Stage 3 also supported increased patient access to self-management tools and prioritized a much more robust and effective health information exchange. When the MU program began in 2008, only 9.4% of hospitals were using an EHR system. This number increased to 84% by 2015, a nine-fold increase over 7 years. Throughout this journey, the lofty goals of meaningful use has certainly met its share of challenges, however. In a 2018 article by Health IT News, 3 key elements where meaningful use had been unsuccessful in achieving its goals were identified. First, it was acknowledged that while Stage 3 meaningful use had focused sharply on growing interoperability throughout the industry, the goal was, by all accounts, overwhelmingly not met. It was noted that most EHR systems continued to struggle with effective communication, leaving healthcare organizations to develop workarounds and redundant processes, which would then support a more manual interoperability process. Second, the growing volume of electronic health records, coupled with many workarounds, in turn created heightened security concerns for healthcare organizations. Firewalls, security systems, virus scanners, and duplicate login processes certainly did help with the security of PHI. However, the human factor continues to be the weakest link in most security systems. This human factor can at times compromise even the most elaborate and complex security system, and therefore the most apparent solution to this concerning issue is focused squarely on continuous education coupled with effective management of personal behavior. Finally, a challenge associated with meaningful use has been increasing staff burnout. While these EHR systems are costly, they often do not provide the intuitive and user-friendly platform that most users expect. In our age of smartphones, smart homes, and intuitive technology, users want a system that learns and responds to their specific patterns. In turn, financial constraints often restrict the amount of support that has been available to really support end-user customization. This challenge has posed a no-win scenario for CIOs across healthcare organizations, and until further technology really supports increased user intuition, better and smarter security features, and significantly improved interoperability, CIOs and their organizations will continue to struggle with overcoming these challenges. In an effort to partner with CIOs to address these ongoing challenges, meaningful use has been transitioned into one component of the new merit-based incentive payment system, otherwise known as MIPS. In a 2016 interview, Andy Slavitt, the acting administrator of U.S. Centers for Medicare and Medicaid Services, identified a coming turning point in meaningful use. Quote, "The meaningful use program as it has existed will now be effectively over, and it will be replaced with something better. The focus will be away from rewarding providers for the use of technology and towards the outcome they actually achieve with their patients. And finally, we are dead serious about interoperability." Unquote. While the meaningful use as a standalone program has certainly seen its sunset, the important foundation that meaningful use established has paved the way for bigger and better achievements through the new MIPS program. The key takeaway is threefold. First, Meaningful Use has been an incredibly important program and has paved the way forward for IT system integration throughout the healthcare world. Second, while industry acceptance of EHR systems is certainly a success, three key challenges have surfaced during the area of MU and continue to face healthcare CIOs today. Those three challenges include interoperability barriers, increased security challenges, and growing staff burnout rates. Healthcare technology and information systems will certainly overcome these barriers eventually, but the journey may yet be a long one. With that in mind, the third message is that while Meaningful Use as a program has seen its sunset, the work and vision of Meaningful Use will continue on, and the next step in this journey is being supported by the new MIPS and MACRA programs. Thank you for your time, and I do hope you have found this presentation to be helpful in understanding Meaningful Use and the unique challenges it poses to healthcare CIOs.